afa apomden ho hia yi pa isanse apomden wo ho a ene etimi etechire ome kama se yare no edokodokro na se ye ho emfan a entimi ma oman no enkonkan na apomden so ho hye no aban ye na famu de we see hospitals agenda 111 nyina ba wo tonru drones ambulances nyina apomden menu mi no so de ne ye nyame adaroma enyumaku bi ho mo so do ho agim eboa se ne be ya apomden nkomo no ne ho hye nyina so ebe konkan one of such groups no Elijeku Foundation Anopa cover by the founder the leader of Elijeku Foundation ewa hasia one ba betwetwe nkomo afa pomden ho a megidi ye se yenwie nkomo twetwe no na won so waye nhia opani a meka no ho asemi abrantie kama pa idin ne Andrews Nyantachi Andy memwache
menya mejo so
na wo ho te say
nyame adom boko
Elijeku Foundation Chechimu oyire ne omabidin no aka bomu akoye Elijeku ya na sede.
Well, a very good question. Elijeku Foundation actually me wo ema miensa ema mienu panyin e de Eliana and the Tosumi no e de Jacolia and to din na meka bomu Jacolia
no is it
as
a Spanish Latin bi na me
biblical name na Jacolia ne ba ayo hene one of a me in a bit me acheche mu ye
yeah but say a man as sometimes so just
Eliana and Jacolia and Eli for Eliana and Jacolia yeah but yen mission very simple so be call potemo and individuals and promote preventive health education and me the trail mo say from the beginning, you know, it's very important to give back to the community. Intina me do omudi eto organization as well.
And me sure so many je ho pass.
At this stage, I'm on tinema but yeah.
What saying?
My first born is 6 and second born year 4.
Okay. All right. Lijeko nti preventive health.
Preventive health.
What is preventive health?
So cancer prevention is better than cure, you know, and you should say na efutu aye de mai no se bibi utimi si bibi ano ansana aye kese agensemo a preventing them bebre. And for us, access to care in Ghana is very difficult, and I know the government and stakeholders are really doing their best to improve healthcare. And organizations like us, and so you madam for doctor for Edin Komamo say most of the time something share 80 patients a day, which is a lot of patient load. And say conditions that are Modeba hospital, we have malaria, we have cholera, you know, those are conditions that it could easily be prevented. And your father wants to say communities near who say in Sota, a bit two community for no effort near communal album, near drainage science, and say, yeah, and Tontum Entimania, the engineering or that area, or say a cover bina why you fear a name amount for bed, and Ebidin Commonia catch on say, hey, my area has a proper has a illnesses in the ember, and also individual health. So on say program and some say a lot of the conditions who are hypertension. All right, and I'm on phone call hospital until I almost say every year be a modern call hospital go get seen. Now you assessment now you say you who and tema a bit me then aswano. That is the whole mission of Elijeku Foundation to promote preventive health education. Let people know that it's okay to go to the hospital. It's okay to get checked out.
Nti ontna ho krampo emaya de ne mansa no ansa no wakwayare sabia izan se wo yare na wakwayare sabia enye wonkwa na oyare o ebi kwa na yakoje wato ho na oso bi ja na adwuma na wo hwew ni penso na bi okopisi kakra de abehwew na chese akoye nsem bebre nti se obo ho ban na yade no ama na chese no na ekono I think that it includes checkups ya hase no yentampe checkups nti as part of your education no more hammer on the need for checkups.
Yes, we do. So it's okay. You know, it's okay for you to do checkup. And your Candibia or your programs, so say once a year, every year on your birthday, you're celebrating your party, and you be for that time, no, and call. Or to come baby, your annual health assessment, every year you call Dr. Beshe or be check a lab just to make sure everything is in place, you know. You're doing say I'm or more any check, it's just because more they take proactive initiatives when it comes to their healthcare. Yeah, near break, your pesca, your kojom, your cotton bibia, but Ghana, yeah, bibia, your new will be bia, so apart from your health. but penny for say so one kwa owade so nti yema modern na yema ye nko ya health also.
All right, into preventive health education now mo ye. Kwambe so na mo fa so amoye. Do you come on air, radio, TV, social media? Na mo educating crofo and say you go down to the people and talk to them.
When that's any question, Alija started here now. We've done different things. We use different avenues because there's different ways to approach people or reach people. Until your radio show every Monday, you know, or one of the stations at Kumasi. Your social media platform. Once in a while, say the Aba TV, so we'll do that. Your co schools and so until we've been to almost all the schools in Ghana. Your call and sorry. Now some COVID by the encore by yet and sorry. Then near event is a Saturday, you know, where we bring doctors, nurses, specialty groups together near community, near provide free health screening. Ama community, you know.
Okay, let me just say also more radio programmer. Is it once a week?
Once a week.
So me sure say the next destination will be Garden City TV. Once a week, then you come here and educate people on the need to take care of their health.
Yeah, what did you say about me?
Abemawi. Amen.
Amen.
Okay. Program mo share among for. Tell me more about that program amoye na saying.
Okay, so program on the 21st or Saturday a chemo. I mean the chemo na a group of doctors free America by the be free Ghana has mobilized a lot of doctors that Pramoso Hospital, Confanoche, Tamale Teaching Hospital, hospitals be or Accra. The Omunyana the Ebo Munti attending to almost over 500 patients dano into oba in program nasia oba nurses oha on triage on take your blood pressure oba mental health specialist into your two for because say Ghana yanka a lot about depression and anxiety and stress into you making sure say you specialist oha money amount for bekasa about stress management, about depression management, also you're talking about financial management. But I said, until we had Prudential Bank there to give education on preventive, on how to manage money. You know the importance of saving. If we were no who eye team, until eye Dr. Mankwa, he was there to do eye care, and he realized it, baby. So a lot of people in Ghana actually need a lot of eye care, a big issue. So from the eye care. You go to the general medical doctors, you know, and they took care of people. A lot of the participants in the mobile program were around Bosuo area, and we actually realized that hypertension is a big issue in that area. Until we need to really do more education there. Until we are now called dentists, or then we're back down to nutrition and first aid. Now your health insurance. Until be about a free health insurance registration to that
really
office as any partnership.
Health insurance.
Health insurance.
And I'm renew my
we did renewal. We did we did health insurance for them for free.
For how many people?
We served about 500 people until health insurance for better data now. But that is what I believe say. Staff.
We're a huge program.
It is
huge program.
It is.
Doctors from North.
Yes.
South.
Yes.
From America.
We brought everybody.
Na Mosai Emma Manfudru.
Yes.
Mosai register more for free. How are you able to raise funds? How are you able to generate funds to undertake activities we see now?
Amazing. Me catch Obi Hawa, your organization started. We started just a small idea. Me and my wife. Then many doctors be Kasawa has say no more and since we started everything has been supported by me and my wife, you know, through it. But yeah, the BMG say
I love that my wife.
My wife, yeah, she my boss on she's my supervisor.
Wife.
Or
your boss.
I'm boss, yeah. Yeah, she's
when you chairman.
On you chairman, but she's an amazing woman, you know. Yeah, she's very smart and can be so or can't then it goes back into she's my prophetess, she's BB. But
is she black
or Ghanaian?
Or Ghanaian?
And I call secondary school tech sec.
Right.
Majima, yeah.
I told them the chassis free SS.
But why?
And I'm to school or uni.
But I said Obama pass. Yeah, but yeah, she's
amazing woman.
Yeah, and
great.
Yeah, we just talked about this and Boy and Juana and then Abedru has it. But that the BMG say, "Yo, I'm on it now. You want someone for be brave, but support for without really having evidence to show. And the say, to build the momentum, to build the evidence to show. And difficulty and maybe I was supported by us and locally. Program where Maranatha Restaurant or Doom, they supported us and different individuals, But to Free America by the Omobotumska said this is a good thing. We want to come and support. And supporting I think it's a question. My answer is but everything is from God.
All right, so we know a successful one. I don't think that was your maiden program.
No. Other organizations, a partner or Accra, Open. And few community events, but this is really one of the major ones.
And through a screening, I'm here for over 500 people. Common ailments and I say common diseases are more identified in ABA there.
I think I touched on it already. Hypertension is one of the.
Or the look pressure.
Yeah, pressure. More blood pressure. Then it was.
Penifo and Anquada.
And Penifo and crying. It was missed. And technically, as a doctor for here, you need 3 consecutive BP checks. Ever check your BP for a namians at so and Sunday to me, I conclude this or hypertension. But for our event, doctors need to keep time every day blood pressure 3 times because that short period of time until they had elevated blood pressure. A bill in hypertensive crisis. Until you man not echo hospital, my car at an echo hospital because hypertensive crisis is a big emergency. I know now you doctors know I'm more a little bit research. I'm the report but call Ministry of Health so that they know. So people around that locality, Dr. Mankwa, eye specialist, also had a lot of patients more eye concern. They didn't have a lot of dental concerns, but they had a lot of eye concerns. And those 2 things.
Glaucoma.
Yes, glaucoma. Yes, glaucoma was one of the issues or address it, and he did an amazing job with his team. Just really educating people on the need to take care of our eye. People really didn't focus on dental, but your health started from your nose, and Ushema. If there is an infection,
that is a dental. You have nipa down coho.
Any coho, but not amount for any much focus on or be by any. But we really hope that you be taking care of your nose because a lot of things happen from our mouth and affect so many things in our body.
All right. Until Ura Andrews Nantechi, the founder of Elijeko Foundation, and I didn't come about preventive health year. Omo ewo omaimu achese ebwapa ama ne amu ye mo hu se nipa bebre yare ehhehye ho a chese tutumi se ya hase no ewuo basa bia brantie babawa bihu an se otada ho ya na etabo ye ma me no ma nyame ehire omo anyini no omo ne ebo omo bayi ena omo kunkunkunkum adehye wo fire na ekeka ho yesi duabo bi na ye de bo bi a wa free mu ni nyina ye yare bi ehye ho a yennim ena ya na ede ekọ na de ya esan yare ho sem kura ne se nipa na free mu kura no ade efe ne postmortem anke be ye hwehwemu ne ye hunu se ade we se ne kun no bi okọ omo se ye hu nyia ne akosie ye de hye na ade no kwa na ekọ ntimi giri ye se ehu hia se ye be yes normal we see bi ne ehunu ne ha yen ansa na daboni bi aba. So after this successful programming, what next for Elijeko?
Yeah, a lot of ideas. Again, we are going to continue to give more education. Program way you be more often because who say need elho. Me what you do Ghana say Ghana will improve when it comes to healthcare, but a responsibility of all of us to come on board to support government initiatives, go to the community and bring healthcare to the doorsteps of the people. Majidi Power said we'll get there. We'll really get there.
So, what's US?
Much why?
COVID de muhu ne course pa.
Yes.
And I wa bagana so hu se ne COVID is it here. To share se ne yen isi ye normal wa high na wo se ne COVID here na. Are we doing things right?
I would say yes and no, all right. US and so it's almost the same, all right. But I think at the end who can say what people are really not wearing their mask. But who here say obesha mask. They be me US, not me military. I did a little bit healthcare. They say me school and they be me catch a patient and me on can't almost say, preventive BBI. It's not really for you, but it's for the other person there. Until make us say me ma me until say me pia bontene na man share my mask now me get infected me be fear I'm actually going to affect my children. I may affect obi a wa bontene me de be affect obi a oyeden oben me nti de oben wo ne de odon nti ehun hia say oyeden o show mask only opportunity to get vaccinated, and so it's very important to go get vaccinated. I mean, say a lot of teachings are out there, but we've been able to cure polio with vaccine. We eradicated polio with vaccines. We've done so many things. Science abwa to promote health around the world. Bible say Nyankopon and the Bibia. Me did say Nyankopon so na a doctor for a scientist nyansa amutimi develop Bibia and to any opportunity to get a vaccine. Ehun hia so be the vaccine. But Mr. At here for no be our share, so more than no more show mask be more than it will be.
All right, yen share mask no be will be a vaccine as okay. Say good news Anopa me ready on BBC and say US are granted Pfizer COVID-19 vaccine for you to say we enye ya no say omo approve emergency approval na edema, but this time there yamo full recognition as vaccine or the year juma ebe just bibia koso a Pfizer for no aya dia me sure say other ina aka no so ebe follow na say enoma so etimi akoso enti yen share at what age ena yese obeye take preventive healthcare seriously. At what age ne bia also call checkups na okọ say bibia air coso di 50 ho corner na say even 20 years we are branch ekra also to ma wapom de ehun hia.
I will say obia there's no age limit. Also obia ekọ checkup until I will for me show mun cry say ehun hia. Say mama I would don't be check-up, but most of the times I am more concerned about more money and won't feel anymore. Because as I say what talk for brand new BBL, but or the core road no so not bump kakra then you need to do servicing. Today I'm catching a man for say every 6 months for the US also check your car or the car for servicing. That is why it's important. So say every time.
Mandatory.
Mandatory. You have to go do oil change and all those things. Until obi our car or the car call for servicing. Until at the end I servicing. But also to the mechanics. Until here it doesn't really matter how old you are. I would say a call hospital now call check up frequently.
Ebi a high sick asem no. Oh, here nipa no do be di kura no ebi e den ma no. Na be ko check up yi na onyare o so onko no onko check. Enti check ni mi nu a na the problem be na about send now can also stress management ya dia mo kan ho asem ebe na if you look at the environmental factors here normal stress no doso ebe na otimi manage ne ho send ebe ya stress no kofa problem bia emre no.
I think it's about going for care now. Nyame adom Ghana will have insurance, all right? Until at least you be encourage obi say until a program na dey kan ho no. Say uni bia oba ebeboa na yenya health insurance na den amount. But stress management ade eboa me personally say me na me yere ekasa. Until if you have somebody within you yen kan ya some amount for because it's really say obi be kan atre obi or den wa bonte. But Ghana is a very religious country. You was suffer for higher one penny for assembly show too much obi na nkasa. Just have conversation, talk about your feelings na bibia den ekoso ebia but preventive health education is really important. Ebe save you be answer what in
asuma kan me de pa e ma asem no enhye oso na ntitio na nkono madru talk to somebody what trust no me boa
yes
obitimi aboa na e ma won kofa oha bia ma oso. All right, menim sibia wo message bia wo de ebe twa to de ama ahwefo na atifo bia se obi kra pe obi asori bi hwehwe community bi hwehwe mo say bia mo meboa mo na mo ntimi organize free screening bi ne preventive yi bi mo ma ebe de no matimi ehu.
Okay, me need your number no off head but me de be ma na in the future why but I think say idea year from this year echo and they say educate patients on their rights and their responsibilities when they go to the hospital. The last time I call hospital, utiminya doctor now any dean come busa questions. Many amount for baby reading come say, hey, doctor, they acquire musa na semo. But who here? And Mr. Ete for no be our and self hospital and yamre nebusa doctors no question about health. Nurses for your juma and say be ma wo mu aye bia wo hia bia be cho edro no emra wo so nom no side effect obenya adverse effect obenya ni na part of patient safety until bia Mr. Hospital na for your check up busa question ne hu nya ntiase adequate a den wo any adequate a why doctor no den prescribe the type of treatment or the amount here but so me me say one can you know one can you bone I don't know maybe na my so nti ehun hia
you know so one kasa utri ho a you bone
hospital your mom den you say nurse for no questions you say doctors so question
I mean, there's all the assembly saying so a chat for instance Garden City TV ya fa is a normal reaction say ye be buana sa da obu we na etimi akoso nti adwumaku ba ko advocacy for medical malpractice victims almost bo ho the right ya discuss about patients' rights and their responsibilities and I hope say education e dey man nyina no Ghana for be tie na so pem na boama say fix the country never akọ for me boa
responsibility. The government greater part. Okay.
Oh, sure.
Responsibility. I'll say that.
Right. Government is providing Agenda 111. You're also providing education. We are fixing the country.
Me a non-profit, so I'll stay on the non-profit side.
Andy, Yadasipi, say Anopa, Wabayi Instra, we wish you all the best now. Mijiri say this engagement between you and Garden City, because na ya share the bit me aye na ye affecting our health in this country. Na me sha pass by.
Me da se.
Ebisa for nti ye de apomden common